All right, these are some drills and ideas for if you have knee pain. The first thing we talked about was one, having some kind of assessment. So make sure you're assessing your pain-free range of motion. So perhaps my knee pain is when I lock the knee out, perhaps when it's bent to a large degree, or as I bend down, and find how far you can go without any pain. And then that's your assessment after each of these drills to see, can you go farther? And that's what we want to be able to do, is get a little bit more range that's pain-free. So the first thing we're going to talk about is some skin stimulation around the knee. So wherever your knee pain might be, you can use your knuckles and gently rub. Skin's the biggest organ in your body. It's highly innervated with lots of different types of nerve endings. So giving some skin stimulation around the knee, perhaps on the kneecap and your patellar tendon here, on the inside and outside of the knee, and then also on the back of the knee, can sometimes be very powerful. And this is also not a bad thing to do right before doing these drills anyway, because just by doing this, we're drawing a lot of attention to your brain about the knee. So do some skin stimulation, assess that, and see if that changes. That alone changes your pain-free range of motion. The first drill is going to be seated tibial rotations. So from this position, with my knee, I'm going to, around my kneecap, I'm going to put my fingers kind of below and to the sides of the kneecap, kind of on each side of that patellar tendon there. You'll feel a little depression. And then I'm going to have my heel on the ground, and I'm just gently going to turn my lower leg in and then out. And you should feel the bony protrusions of the tibia as you're moving that. Now your foot's going to move, but don't think about just pointing the foot. Think about your shin bone and getting actual tibial rotation. Inside is often more hard, more difficult than outside for most people. And also be sure we're not moving up here at the hip. We're only moving right at the top of that tibia there. After about 3 to 5 reps in each direction, go ahead and reassess your pain-free range of motion. The next drill is hanging knee circles. I'll do this from a seated position, but I could do it standing as well. So this would be an open chain, meaning I don't have my foot on the ground. So I'm just going to support my leg, my upper leg here by holding it. And I'm trying to relax this lower leg totally. So I'm not tense on the leg and the musculature here. I'm just letting my foot hang. And then I'm just going to draw a circle with my lower leg. So I'm trying to get as much flexion as possible. Now you'll notice you'll have some internal and external rotation in your hip joint while you're doing this, and that's fine. And I want to do 3 to 5 repetitions in the other direction as well. I'm trying to just keep that lower leg as relaxed as possible. And try to find, do you have some sticky spots or some areas that are hard to move in this circle? After you've done that, 3 to 5 reps in each direction, reassess your pain-free range of motion. The next one we're going to do is standing knee circles. So in this, from a neutral position, meaning my feet are right underneath my hips, I'm going to step out slightly with my working leg, just to a slight lunge. Doesn't have to be super deep. And I don't have to put all my weight on this working leg either. I can leave most of my weight, which is what we prefer at first, on this rear leg. So to do the knee circle, I'm going to start from a locked out position, and then I'm going to start to bend the knee and push the knee inward. And then as I bend the knee more, I'm going to circle around over my toes to the outside, and then back to locked out. Now notice that the ball of my foot and my heel are staying on the ground. The arch will rise as I go to the outside. The arch will fall as I go to the inside. But I'm not rotating the hips to make this happen, nor am I letting the foot pivot off the ground like this. The foot is staying flat here. I'm going to go in the opposite direction. And just go as far as you can right now, that you can keep that ball of foot and the heel on the ground. And also watch out for turning the hips to try and make this happen. Hips stay square, foot stays flat. 3 to 5 repetitions each direction, reassess yourself. Last one, is the femoral nerve glide. So the femoral nerve innervates the quadriceps. A lot of times, if we've got really tight quadriceps or issues there, that can lead to some patellar tendon pain in the front of the knee and that kind of thing. So we'll demonstrate this real quick. This assumes you can put your knee on the ground without any pain. If you can't, don't do this one right now. So from this half kneeling position, I've got a little chair here that I can kind of support myself. I'm going to go into some very particular joint positions to gently tension the femoral nerve, which innervates the quadricep and goes all the way down through into the patellar, affects the patellar tendon. First thing I'm going to do, think about my pelvis. I'm going to tuck my tailbone. That will immediately give me more stretch here on the front of the quadricep and at the hip. After I've tucked the tailbone, I'll maintain that and I'll glide the hips forward. That will increase the stretch even more. And then I'm going to bend and rotate to the opposite side. So I can put my arm over my up leg, and then I will glide the nerve by just gently pushing back and forth. Now maintaining that pelvic tilt, because that's important to the nerve getting tensioned correctly. This should not be painful at all. Should feel like a really good stretch. If I wanted to get a little bit more tension, I could use some kind of a block or a rolled up towel, small ball that won't roll away from me, something like that, which will give me a little bit more knee bend, a little bit more flexion in the knee. I tilt, I glide forward, I bend and rotate, and then I glide. And that adds a little bit more tension with the increased knee flexion.